Earlier in 2022, the CDC began tracking a disease not normally seen in a place like the United States, known as monkeypox. The first case popped up back in May after a resident returned from a trip to Canada, presenting with headache, fever, and other flu-like symptoms. But health experts say there's more than one way to distinguish this from other common illnesses.
And you'll develop a very specific rash, and the rash can be in the form of these little, what they call papules, or these little bumps on the skin and redness. And it can develop diffusely all over the skin or in a location of the body in one specific region.
Early data on the outbreak suggested that men in the LGBTQ+ community made up a high number of initial cases. Dr. Nistico says sexual orientation and gender identity isn't the cause, but intercourse may have something to do with spread.
They don't know if it's transmitted through vaginal or seminal fluid, but they do know that if there's close proximity, which could be that if you're contacting a site where there are like lesions or skin lesions or sores of monkeypox, you could transmit it that way.
People in Central and West Africa are often exposed through bites or scratches from animals or through contact with animal byproducts. The source of the infection in other countries is still unknown.
Now they're noticing the spread is amongst human to human, and now it's being spread amongst U.S. soil, and that's really where a lot of the concern comes from.
There are no treatments specifically for monkeypox. Since the virus is genetically similar to smallpox, the same antiviral drugs may be used for treatment.
And they have talked about this, where if you've been vaccinated for smallpox, you may have some inherent protection against monkeypox.
If you have symptoms of monkeypox or believe you came into contact with someone who has the virus, the CDC recommends talking with your healthcare provider and avoiding contact with others until any lesions have scabbed. For Arnot Health, I'm Lexi Cutmore.